Welcome back to Nclex Made Easy 91. In today's session, we'll be diving deep into 50 high-yield Nclex questions on safe motherhood, designed to sharpen your knowledge, boost your confidence, and prepare you for exam success. Every question comes with clear answers, detailed rationales, and smart test-taking strategies to help you master this essential topic in maternal health. So grab your notebook, stay focused, and let's see how many you can get right. Remember, every question brings you one step closer to your RN dream. Question 1. A nurse is educating a pregnant woman on antenatal visits. How often should visits occur in the third trimester for a normal pregnancy? A. Every month. B. Every 2 weeks. C. Weekly. D. Twice weekly. Answer: C. Weekly. Rationale: from 36 weeks until delivery, visits should be weekly to monitor fetal well-being and detect complications early. Strategy: remember, monthly until 28 weeks, every 2 weeks until 36 weeks, then weekly. Question 2. Which of the following is a major goal of safe motherhood? A. To reduce infant mortality only. B. To improve reproductive health and reduce maternal deaths. C. To increase hospital births only. D. To provide free antenatal care. Answer: B. To improve reproductive health and reduce maternal deaths. Rationale: safe motherhood ensures women receive quality care before, during, and after childbirth to reduce mortality. Strategy: link safe motherhood with maternal survival and healthy baby outcomes. Question 3. A woman at 32 weeks gestation complains of headache and blurred vision. The nurse's priority action is to A. Check her temperature. B. Measure blood pressure. C. Assess fundal height. D. Encourage rest. Answer: B. Measure blood pressure. Rationale: these symptoms suggest preeclampsia, hypertension must be identified early. Strategy: headache plus vision changes equals check BP first. Question 4. Which nutrient is most important to prevent neural tube defects in the fetus? A. Iron. B. Folic acid. C. Calcium. D. Vitamin D. Answer: B. Folic acid. Rationale: folic acid before conception and in early pregnancy prevents neural tube defects. Strategy: F4 folic acid equals fetus spine protection. Question 5. Which action by the nurse best promotes safe motherhood during labor? A. Administering routine oxytocin immediately. B. Monitoring fetal heart rate regularly. C. Encouraging frequent vaginal examinations. D. Allowing labor to progress without supervision. Answer: B. Monitoring fetal heart rate regularly. Rationale: continuous fetal monitoring helps detect distress early, ensuring safe delivery. Strategy: safety equals assessment before intervention. Question 6. During postpartum care, which finding requires immediate attention? A. Fundus firm and midline. B. Lochia rubra for 3 days. C. Temperature of 38.5 degrees Celsius. D. Slight perineal discomfort. Answer: C. Temperature of 38.5 degrees Celsius. Rationale: indicates infection, a leading cause of maternal morbidity and death. Strategy: fever postpartum equals possible sepsis. Question 7. Which vaccine is recommended during pregnancy to protect both mother and baby from neonatal tetanus? A. MMR. B. Tetanus toxoid, TT. C. Influenza vaccine. D. Hepatitis B. Answer: B. Tetanus toxoid, TT. Rationale: TT vaccination during pregnancy prevents neonatal tetanus. Strategy: TT equals 2 lives, mother and baby. Question 8. Which intervention best helps prevent postpartum hemorrhage? A. Delayed cord clamping. B. Early breastfeeding. C. Fundal massage after delivery. D. Keeping mother supine. Answer: C. Fundal massage after delivery. Rationale: stimulates uterine contraction to reduce bleeding. Strategy: after delivery, massage the fundus, not the ego. Question 9. A pregnant woman reports vaginal bleeding with severe abdominal pain. What is the most likely diagnosis? A. Placenta previa. B. Abruptio placentae. C. Ectopic pregnancy. D. Threatened abortion. Answer: B. Abruptio placentae. Rationale: painful vaginal bleeding plus tender uterus equals placental abruption. Strategy: painful equals abruption, painless equals previa. Question 10. A woman in labor is lying flat on her back. The nurse notices fetal heart rate drops. What should the nurse do first? A. Increase 4 fluids. B. Turn the woman to her left side. C. Check cervical dilation. D. Administer oxygen. Answer: B. Turn the woman to her left side. Rationale: supine position compresses the vena cava, decreasing blood flow to the fetus. Strategy: supine hypotension, turn left first. Question 11. A pregnant woman is advised to take iron supplements daily. What is the main purpose? A. To prevent dehydration. B. To prevent anemia. C. To improve appetite. D. To prevent nausea. Answer: B. To prevent anemia. Rationale: iron supports increased maternal blood volume and fetal oxygenation. Strategy: iron equals I run on oxygen. Question 12. Which symptom is a danger sign of pregnancy requiring immediate reporting? A. Mild ankle swelling. B. Headache and blurred vision. C. Increased appetite. D. Fetal movement. Answer: B. Headache and blurred vision. Rationale: indicates possible preeclampsia or hypertension. Strategy: always treat headache plus vision change as an emergency. Question 13. Which component is part of birth preparedness? A. Waiting for labor to start naturally. B. Selecting a skilled birth attendant. C. Avoiding hospital delivery. D. Relying on traditional birth attendants only. Answer: B. Selecting a skilled birth attendant. Rationale: skilled attendants reduces maternal and neonatal deaths. Strategy: preparedness equals people plus place plus plan plus package. Question 14. Exclusive breastfeeding is recommended for A. 3 months. B. 4 months. C. 6 months. D. 9 months. Answer: C. 6 months. Rationale: provides all nutrients and immunity needed for the first 6 months. Strategy: 6 months of milk, no water, no formula. Question 15. The most accurate measure of maternal health improvement in a country is A. Birth rate. B. Maternal mortality ratio, MMR. C. Infant weight. D. Number of hospitals. Answer: B. Maternal mortality ratio. Rationale: reflects the number of maternal deaths per 100,000 live births. Strategy: MMR equals measure of mother's risk. Question 16. What is the purpose of using a partograph during labor? A. To measure fetal size. B. To monitor progress and detect complications. C. To record mother's meals. D. To estimate blood loss. Answer: B. To monitor progress and detect complications. Rationale: partograph prevents prolonged labor and maternal exhaustion. Strategy: partograph equals partner for safe labor. Question 17. Early registration for antenatal care is recommended before A. 8 weeks. B. 12 weeks. C. 20 weeks. D. 28 weeks. Answer: B. 12 weeks. Rationale: allows early screening and timely preventive care. Strategy: register before end of first trimester. Question 18. Which statement about family planning and safe motherhood is true? A. It reduces pregnancy risk and promotes spacing. B. It causes infertility. C. It's only for married women. D. It's unsafe for breastfeeding mothers. Answer: A. It reduces pregnancy risk and promotes spacing. Rationale: proper spacing improves maternal recovery and child survival. Strategy: family planning equals family health. Question 19. Which measure helps prevent malaria during pregnancy? A. Vitamin C. B. Intermittent preventive treatment, IPT, with SP. C. Early delivery. D. Iron tablets only. Answer: B. Intermittent preventive treatment, IPT, with SP. Rationale: IPT and insecticide-treated nets prevent maternal anemia and fetal loss. Strategy: malaria prevention equals SP plus net. Question 20. At 28 weeks, an Rh-negative mother should receive A. TT vaccine. B. Rh immunoglobulin, ROGAM. C. Iron injection. D. Influenza vaccine. Answer: B. Rh immunoglobulin, ROGAM. Rationale: prevents Rh sensitization and hemolytic disease in the newborn. Strategy: 28 weeks think ROGAM. Question 21. Which postpartum finding indicates hemorrhage? A. Firm uterus, scant lochia. B. Boggy uterus, heavy bleeding. C. Fundus below umbilicus. D. Pink lochia after 7 days. Answer: B. Boggy uterus, heavy bleeding. Rationale: a soft, boggy uterus indicates atony and risk for hemorrhage. Strategy: firm is fine, soft is scary. Question 22. A woman develops convulsions during pregnancy. What is the most likely condition? A. Preeclampsia. B. Eclampsia. C. HELLP syndrome. D. Seizure disorder. Answer: B. Eclampsia. Rationale: eclampsia is preeclampsia with seizures. Strategy: eclampsia equals emergency. Give MGSO4. Question 23. Which intervention promotes safe breastfeeding? A. Bottle feeding after birth. B. Putting baby to breast within 1 hour. C. Feeding every 6 hours. D. Discarding colostrum. Answer: B. Putting baby to breast within 1 hour. Rationale: early initiation promotes bonding and uterine contraction. Strategy: golden hour equals first hour of life. Question 24. Which statement best describes postpartum depression? A. Normal sadness after birth. B. Serious mood disorder needing evaluation. C. A temporary sleep issue. D. Always caused by poor support. Answer: B. Serious mood disorder needing evaluation. Rationale: can impair mother-infant bonding and must be addressed early. Strategy: screen all mothers, mental health equals maternal health. Question 25. The best way to prevent puerperal sepsis during delivery is A. Frequent vaginal exams. B. Aseptic technique. C. Delayed delivery. D. Cold compresses. Answer: B. Aseptic technique. Rationale: clean hands and sterile equipment prevent infection. Strategy: clean hands save mothers. Question 26. Which of the following most contributes to reducing maternal mortality? A. Skilled attendance at birth. B. Traditional birth attendance only. C. Herbal medicines during labor. D. Home delivery without supervision. Answer: A. Skilled attendance at birth. Rationale: skilled birth attendants can identify and manage complications early, ensuring safer delivery. Strategy: safe birth equals skilled hands plus clean environment. Question 27. During antenatal care, the nurse advises the woman to sleep on her left side. The purpose is to A. Improve digestion. B. Increase placental blood flow. C. Prevent back pain. D. Prevent heartburn. Answer: B. Increase placental blood flow. Rationale: the left lateral position prevents vena cava compression and improves fetal oxygenation. Strategy: left side equals life side. Question 28. A mother with HIV asks how she can protect her baby. The nurse should advise A. Stop ART drugs. B. Take antiretroviral therapy, ART, consistently. C. Avoid all medications. D. Breastfeed exclusively for 1 year without ART. Answer: B. Take antiretroviral therapy, ART, consistently. Rationale: ART reduces viral load and risk of mother-to-child transmission. Strategy, adherence equals protection. Question 29. Which finding during pregnancy requires urgent referral? A. Mild leg cramps. B. Severe headache and blurred vision. C. Back discomfort. D. Increased urination. Answer, B. Severe headache and blurred vision. Rationale, indicates preeclampsia, a major cause of maternal death. Strategy, danger signs equals refer immediately. Question 30. A nurse teaches a pregnant woman about nutrition. Which food promotes iron absorption? A. Tea. B. Milk. C. Orange juice. D. Coffee. Answer, C. Orange juice. Rationale, vitamin C enhances iron absorption. Strategy, C plus iron equals strong blood. Question 31. A nurse notices the mother's fundus is firm but bleeding continues. What is the possible cause? A. Uterine atony. B. Vaginal or cervical laceration. C. Retained placenta. D. Infection. Answer, B. Vaginal or cervical laceration. Rationale, a firm uterus with bleeding indicates trauma rather than atony. Strategy, firm uterus plus bleeding check for tears. Question 32. To prevent neonatal tetanus, a pregnant woman should A. Take folic acid. B. Receive TT vaccination. C. Take iron tablets. D. Use mosquito nets. Answer, B. Receive TT vaccination. Rationale, 2 doses of tetanus toxoid provide protection to mother and newborn. Strategy, TT equals 2 doses, 2 lives. Question 33. Which intervention helps reduce postpartum infection risk? A. Encourage early ambulation. B. Delay perineal care. C. Avoid breastfeeding. D. Apply cold compress on abdomen. Answer, A. Encourage early ambulation. Rationale, promotes circulation, reduces risk of thrombosis and infection. Strategy, move to improve. Question 34. What is the nurse's best response when a mother complains of cracked nipples? A. Stop breastfeeding. B. Apply breast milk to nipples after feeding. C. Use alcohol to clean nipples. D. Increase feeding intervals. Answer, B. Apply breast milk to nipples after feeding. Rationale, breast milk contains healing antibodies and keeps nipples moist. Strategy, nature's best ointment is breast milk. Question 35. The first sign of postpartum hemorrhage is A. Drop in blood pressure. B. Rapid, weak pulse. C. Excessive vaginal bleeding. D. Pallor. Answer, C. Excessive vaginal bleeding. Rationale, visible heavy bleeding is the earliest and most obvious sign. Strategy, observe pad saturation every 15 minutes after delivery. Question 36. A nurse is assessing a woman in labor for progress. The partograph shows the alert line crossed. The nurse should A. Continue observation. B. Prepare for referral or intervention. C. Give fluids only. D. Encourage more ambulation. Answer, B. Prepare for referral or intervention. Rationale, crossing the alert line indicates delayed labor progress, needs skilled review. Strategy, alert line equals act immediately. Question 37. Which of the following is a component of a safe delivery? A. Clean hands. B. Clean blade. C. Clean cord tie. D. All of the above. Answer, D. All of the above. Rationale, the 5 cleans ensure infection prevention during childbirth. Strategy, clean hands, surface, blade, cord tie, and baby. Question 38. A postpartum woman complains of dizziness and weakness. Her pulse is 120 bpm, BP 90/60 millimeter of mercury, and she is pale. What is the nurse's priority action? A. Check fundal firmness. B. Call the physician. C. Offer fluids. D. Encourage rest. Answer, A. Check fundal firmness. Rationale, assess for uterine atony, the most common cause of postpartum shock. Strategy, in bleeding assess fundus first. Question 39. What is the primary purpose of postnatal visits? A. To check baby's vaccination. B. To monitor recovery and detect complications. C. To provide family planning counseling only. D. To weigh the baby. Answer, B. To monitor recovery and detect complications. Rationale, early postnatal follow-up helps identify hemorrhage, infection, or depression. Strategy, postnatal equals post-safety check. Question 40. A nurse teaches the mother to initiate breastfeeding within 1 hour after birth mainly to A. Reduce jaundice. B. Promote bonding and uterine contraction. C. Increase milk supply only. D. Prevent crying. Answer, B. Promote bonding and uterine contraction. Rationale, early breastfeeding enhances oxytocin release and reduces hemorrhage risk. Strategy, first hour equals golden hour. Question 41. A woman reports not feeling fetal movement for 24 hours. The nurse should A. Reassure her it's normal. B. Schedule immediate assessment. C. Encourage more fluid intake. D. Advise rest. Answer, B. Schedule immediate assessment. Rationale, absence of fetal movement may indicate fetal distress or demise. Strategy, no movement equals no delay. Question 42. What is the most effective measure to prevent maternal infection during delivery? A. Antibiotics for all women. B. Strict handwashing and sterile equipment. C. Short labor. D. Cold environment. Answer, B. Strict handwashing and sterile equipment. Rationale, hand hygiene and sterile techniques prevent cross-infection. Strategy, clean hands save mothers. Question 43. A nurse notes the uterus is deviated to the right after delivery. The most likely cause is A. Uterine rupture. B. Bladder distension. C. Retained placenta. D. Infection. Answer, B. Bladder distension. Rationale, a full bladder pushes the uterus out of position and hinders contraction. Strategy, void before and after delivery. Question 44. Which vitamin helps in calcium absorption during pregnancy? A. Vitamin A. B. Vitamin C. C. Vitamin D. D. Vitamin B12. Answer, C. Vitamin D. Rationale, vitamin D facilitates calcium absorption, essential for fetal bone development. Strategy, D for density, bone. Question 45. What is the most effective family planning method during breastfeeding? A. Combined oral contraceptives. B. Depomedroxyprogesterone injection. C. Intrauterine device immediately after delivery. D. Lactational amenorrhea method, LAM. Answer, D. Lactational amenorrhea method, LAM. Rationale, effective up to 6 months if breastfeeding exclusively and menses not returned. Strategy, 3 conditions equals no ovulation. Question 46. Teenage pregnancy increases the risk of A. Gestational diabetes. B. Preterm birth and anemia. C. Overweight infant. D. Multiple gestation. Answer, B. Preterm birth and anemia. Rationale, adolescents often have nutritional deficiencies and underdeveloped pelvises. Strategy, teens equals twice the risk. Question 47. Which of the following is a key principle of respectful maternity care? A. Routine episiotomy. B. Maintaining privacy and dignity. C. Limiting family presence. D. Withholding information. Answer, B. Maintaining privacy and dignity. Rationale, respectful care promotes trust and positive birth experiences. Strategy, respect saves lives as much as medicine. Question 48. What is the most common cause of maternal death globally? A. Anemia. B. Postpartum hemorrhage. C. Sepsis. D. Eclampsia. Answer, B. Postpartum hemorrhage. Rationale: hemorrhage accounts for about 25 to 30% of maternal deaths worldwide. Strategy: bleeding kills fastest, prevent and act early. Question 49. Which newborn care practice supports safe motherhood? A. Separating baby from mother. B. Keeping baby skin to skin after birth. C. Delaying breastfeeding. D. Using formula from day 1. Answer: B. Keeping baby skin to skin after birth. Rationale: skin-to-skin contact regulates temperature, heart rate, and bonding. Strategy: mother's chest equals baby's best warmer. Question 50. The ultimate goal of Safe Motherhood Initiative is to A. Reduce fertility rates. B. Ensure no woman dies while giving life. C. Promote hospital construction. D. Increase number of nurses. Answer: B. Ensure no woman dies while giving life. Rationale: the initiative promotes access to quality maternal and newborn care. Strategy: safe motherhood equals healthy mothers, healthy babies. Great job making it to the end of today's Safe Motherhood NCLEX review. You've just covered 50 key questions that can appear on your exam, and more importantly, you've learned the critical reasoning behind each one. Now it's your turn. Drop a comment below and tell us how many you got correct. And let us know which topic you'd love us to cover next. If you found this video helpful, don't forget to like, subscribe, and turn on the notification bell, so you never miss any of our NCLEX review sessions. This is NCLEX Made Easy 91, where we make learning simple, smart, and stress-free. Until next time, keep studying, keep believing, and keep moving closer to your RN dream.